Vaikunth?
Am I audible now?
Yes.
All right. Yeah. So we have Jesu ma'am joining us from Sneha, as well as Sindhura from NAS Foundation. So thank you very much for joining us. They work primarily in the space of HIV, AIDS, as well as sexual health. And that's a very crucial aspect of the sector that really requires community engagement and outreach on a regular basis. So it's a lot more challenging to do that online or to even continue to access the community. So it's wonderful to have you here. And I really look forward to learning from you how you've gone on to reach the community in time of this unprecedented pandemic. So thank you very much for joining us.
Right. All right. Thank you. Thank you, Vaikunth, and welcome everybody. We apologize for the delays. This is also the first time that Indie Village has gone virtual, and despite all the webinars that we have attended, it's always new when you are doing it yourself and very nerve-wracking, right? I'm Shreya, and I'm going to introduce Indie Village and Samvāda and quickly set context of why we're here today. As you can, I'm hoping everyone can see my screen. This is from one of the past events that we had done. So some of you might be able to see yourselves on the screen as well. 1 second, sorry. Yes, right. So Samvāda was started by Indie Village. We're an organization that works on rural development in India, and we focus on livelihood, education, and gender. We work also with partner organizations in rural India on various sustainable development goals based on local needs. Samvāda was started in August 2019 in our Bangalore office as a way to bring people in the impact industry together, because we felt that because we are so busy in doing what we do, we're so passionate about what we do, all the work, and all the research and resources tend to get siloed between organizations apart from the networks that we have already built. So in order to have more industry interaction, in order to have more exchange, and in order to bring people face to face so that partnerships and collaborative offshoots are enabled, that is why we started Samvāda. And as now the pandemic hit us, we've been evaluating for the last couple of months of how we want to do, whether we want to do, is this just another webinar? We realized that as a rural social organization, it became very important for us to focus on the COVID crisis in rural India. And that's why our Samvāda track for the next year is going to be on problems and solutions in rural India, where we'll bring in organizations who have addressed certain problems and created solutions, and that would be their offering to the community. So we will continue to curate this space. We will continue to reach out to more organizations and build our network through this. This is the Indie Village Foundation team, the minds that go behind putting Samvāda together. But my deepest apologies to very key persons are not on this, Utsav and Katya, who you met, who are play a very crucial role in documenting everything that happens before and after the event. Vaikunth will be moderating the event today. I will take you through the flow. Indie Village will also share a little bit about what they are doing based on the current topic. Nikita is making active notes, and if you have something specific that you would like to share with us, with the group today, or with the larger community, please do hit Nikita up separately. Smita is the CEO of Indie Village, so she wears multiple hats. She supports the business team as well as the impact team, and that's how we successively have put together Samvādas in the past. Right. So today, Samvāda focuses on the topic community outreach and engagement. Like I said, the theme or the campaign for Samvāda, Dialogue for Impact, is going to be problems and solutions during the COVID crisis in rural India. And under those, we have prioritized topics that we feel based on community surveys, our interactions with other organizations, things that are pressing, things that are challenges, and things that we have somewhat figured out over the last 4 or 5 months. There will be a scope for you to also nominate organizations or topics that you think are pertinent to rural India at this point of time. The agenda for today, like Vaikunth mentioned, a very integral part of Samvāda Dialogue for Impact is the networking bit, because bringing people together in a room is not enough unless we are able to actively provide a window for them to engage with one another. And I was glad that because of the size of the group, we were able to at least speak to each other. Right now, I will take you through the agenda and a little bit of how we can cooperate and smoothly function today in today's meeting. Then we have the 3 talks where Naz and Sneha are going to talk about staying in touch with the community and how they're managing to do that. Mairara will speak about training and engaging field staff, which is also equally important. Agastya was supposed to speak about impact on field operations and delivery. Indie Village will try to support with a few inputs from our side, but we would also actively like to engage Naz and Mairara to share on these. And then there is the discussion, which is the audience dialogue, where we would love to hear from you what your organization is doing, or if there are further questions that you would like to address to our panelists. So at all points today, do hit the chat box, do write down your questions. We will try to take as many of them as possible during the dialogue and discussion part. Right, so a few housekeeping rules. At all times, if you could please mute your microphones when you're not speaking. During the speaker sessions also, the 15 minutes that are slotted to our organizations, after that, there will be a 2 minutes of synthesis time where we'll just pause, process the information and do our bit of note taking. That is not a Q&A time. The Q&A will open out during the dialogue section after the speakers have shared. Do use the raise hand function at the bottom of your panel if you have any questions or comments, again, after the speakers have spoken. When you have unmuted your mics to participate, be mindful of any background noise and keep your phones on silent, please. If at any point of time you feel the speakers are speaking too fast, we understand. Please hit the go slow function and we'll communicate that to the speaker so that everyone is able to follow what is being shared. And lastly, a humble request to keep all other tabs on your computer screens or your phone screens closed so that you can focus as much in the, on the session. Again, request your cooperation and your understanding. Indie Village has just moved this to a virtual platform. We're going to try and make this as successful as possible, but it's always a collaborative activity for us, and we expect your participation as well. So with that, over to you, Vaikunth. Please bring in our speakers and we launch into the discussion.
Wonderful. Thank you very much, Shreya. So the need to stay in touch with the community as well as ensure health and safety is extremely crucial. And nobody does this better than Naz as well as Sneha. Today, they're going to take us through what it means to stay in touch with the community as well as ensure health and safety. So thank you very much for joining us today. Please do take it away.
Yeah, hi. Thank you so much, Indie Village, for inviting me and Jesu here. And what I'll do is actually the larger conversation should be led by Jesu. So I'll just give a background of what we do and how we are focused on keeping in touch with the community, but really also focusing on keeping our staff front and center. So Naz works on issues of HIV and sexuality, but we also run a huge women's empowerment program. This program works with adolescent girls and young women, and we empower them using life skills and sport. So each year we work with 20,000 adolescent girls across the country. So we have the programs running in Delhi, Mumbai, Bangalore, Chennai, Nagapattinam, Madurai, and Chidambaram. And so in Delhi, Mumbai, Bangalore, we run the program ourselves with the NAS staff. And in the parts of Tamil Nadu and especially in Nagapattinam and rural parts, we run the program through a partnership model. So I think one of the most difficult pieces around the pandemic was the fact that access to the participant community was restricted. And I think that's been one of the most painful aspects of this whole pandemic, because, you know, we are there because of the communities we work with and we serve. And the fact that we couldn't reach out to them in the same way, and neither could the programs run or support be provided in the same way, was one of the most painful points around in the pandemic. And I think early on, what we realized was that keeping people safe and focusing on relief was our priority. So, you know, we had a three-pronged approach which looked at relief, looking at restoration, and then looking at really reinventing and reimagining. So, you know, our first focus, not only with the participants and the families we worked in the urban areas, but also with our partners, was how can we all really focus on providing the necessary relief, you know, because like it's rightly said, COVID-19 is not only the problem, the economic crisis was a bigger issue. And the families not having access to hospitals, not able to go travel to the doctors, you know, not having enough of food and ration support. Networking really became one of our biggest focuses. And I think new collaborations, you know, because NGOs do not necessarily collaborate very effectively. And that's one of the problems of the sector. But I think COVID-19 really showed us that meaningful partnerships is the way forward. And really some fantastic collaborations happened even with the corporate sector to address the issues. Yeah. The second part, before we talk about what our rural partner did, was really on focusing on the mental and emotional health of our staff, you know, because the biggest resource that the NGOs have is these employees of the organization, all our community workers, you know, the coaches who are delivering the program on the ground. They are the biggest resource we have. And I think not only focusing on the physical, you know, keeping yourself safe, you know, the risk levels, physical distancing. We came up with some very interesting videos developed by our staff themselves. And I'm happy to share those links with IndiVillage so that they can be circulated. But this was really that if the participants are so disconnected, yes, there is already a digital divide, but those who have access, how can we really send a message to them? And the second, how do we really keep the staff front and center in all our interventions? You know, the mental health component stood out so clearly. So our question was that in the urban areas, clearly we are struggling with transport issues and access. And I think these got amplified very clearly in the rural areas because there was already other challenges there. And I think at this point, I really would like to bring in my partner and colleague, Jesu, you know, because the situation in the urban areas and the risk levels were very different vis-a-vis the village. And I think Jesu will be in the right position to talk about how Sneha, which works essentially with the fishing communities in rural Nagapattinam, really accessed the participants. Over to you, Jesu.
Share a screen.
Ma'am, you are correct.
Yeah. Can I share a screen now?
Jesu.
Allow பண்றாங்களா சரி
Yes,
no host is disabled
இல்ல நான் சொல்றேன் உங்களுக்கு
இல்ல பரவாயில்லை மேம் நீங்க பண்ணுங்க
no but host has to allow
கரெக்ட் நீங்க ட்ரை பண்ணி பாருங்க நான் அவங்க சொல்லிருப்பாங்க
yeah
நீங்க இப்ப ட்ரை பண்றீங்களா
yeah I am trying
I just enabled the multiple screen
okay
yeah that's good
okay fine yeah here yeah correct yes from current slide yeah yes here we are actually good evening to all of you. Thank you for giving me this chance to speak here and share our experience. Our involvement with children on the day when everything was locked down, entire world was so what to say, they had a fear conscience, everyone, not all coming out, not talking to anyone from the villages also. But in that time, we heard that we really didn't know what to do with our communities and reach out to the children. In that situation, UNICEF announced a program, and it was announced in the media, and every day there was a call given. As far as Tamil Nadu NGOs, an NGO coordinated with UNICEF, and they came out. And every day there will be a message saying for the children to involve in drawing, dancing with their mother. These are all the incidents what they announced for. Indian cultural dresses and habits, and making, so all these things. So we just wanted our children to get involved in that, so that their fear conscious, they should overcome the fear of corona, as well as feel that they are at home. Definitely they were not rural areas. It was unlike the city. They came out of their houses, they were playing, but anyhow, but at the same time, we have to tell them also they need to be safe. So the drawing was mostly focused on safety measures and stay home, stay safe, and fight corona. So they came out with beautiful pictures, and we never expected the children, the mothers will dance with their mother. And how we reached them? It was through volunteers within the village. There were volunteers and the CSCs. They phoned the community. They had contacts, regular contacts with the community, so they phoned them and informed them and pass on the messages. When they pass on the messages, the children got involved. They beautifully made many materials and they played games, and which was all shared with UNICEF. This and also traditional way of playing games. Many things were encouraged, and fancy dress competition, which gave them some space, and using the unused materials at home, and doing displaying beautiful things out of their own creations. Now you can see the children here. They themselves at home. Some children have participated in the fancy dress competition. This is fancy dress. Nothing. They are all in their house. It's also more or less a competition like, but they take video and share it to the number which was given in the thing. These are all videos which really, if you play, they will be saying, I don't want to play all videos, and just one video you can, if you want, we can just play and see. So this is the one video. It is not play, no problem. So there are videos here which definitely when I share, I can send the thing, and the videos will be playing, and they will be saying about what they did and how they really came out of the fear and other things. And next is about the this is with working with children. Now, a space of nearly 1.5 months passed. So UNICEF's program was over, and all the announcements were also over. When the children, those who got involved, then we really wanted to, then there was relaxation of fishing. So fishing activity started, and there was marketing, and COVID spread was also, community spread started, and that was also a threat among them. So how to overcome all those things? We just thought that we can bring the children together in one spot, maintaining the physical distance and supplying them with health and nutritious food. We can facilitate discussions with them through the community sports coaches wherever possible. As we have a strong community with interaction with the women and other elders in the village itself, they also supported that to bring the children. Wherever there was COVID and the villages was blocked, we stopped immediately the coming together of children. Wherever there was no COVID or no COVID was not identified, patients were not identified, we brought the children together and had, now we are conducting nearly all life skills sessions, not the netball, because that we need physical touch. So all life skill classes and also other exercises like drawings, origami, And origami, we through there are some pictures of children coming together, maintaining the physical distances and doing some exercises. Now these are also, they have done something. And again, the main threat and here is, see, some children are very clearly face masks. Some we have to go and insist again and again. Sometimes they don't have face masks. So now the following programs, we have decided to give them face masks as well as sanitizers or hand wash things wherever there is program along with the health mix, so that they can, and also instruction, they are facilitating them to open up with whatever tension they had. So what they have shared out of these sessions when they come out, these are all the things which children did with the paperwork. And now impact shared by children. The children have told, I realized after I came together and saw the outside living, we are living in the same world only. Earlier, we had a feeling that we are living in another world when we were all threatened by corona, that all media played a major role in showing that deaths and being have what is happening in foreign countries. And so it all created a panic among the children. So the children, when they came out and they were able to spell out, and they felt that we are living the same world, and they were able to get rid of their fear only after seeing the coaches. So when the coaches went and approached them, really they were very happy. Now I'm happy and believe that I am in the world of a normal world, not a world where always pandemic is there. Then COVID-19 was also the only a disease which we can overcome. It is not the end of life. So these were the words exactly what the children told. I strictly follow the safety measures, and sometimes there are lapses which we try to monitor and encourage them to follow. I came to know the inner capacities of myself. That was also the children expressed themselves. Now impacts shared by coaches. The first time when I came out, this was by a coach, everyone looked at me as a stranger. What this girl is doing? She's coming out of the village and sitting and talking to children, facilitating children to also come out. So it took nearly 2 weeks to become normal. The community to accept also and give space as community halls wherever the village there are. And now we can see the happy faces in the villages of the children as well as the family. And after children in becoming active only, the village has become normal and usual. They are now seeing the children are able to cope up and understand what really it is. So thanks for giving me an opportunity to share. Thank you.
Thank you very much, ma'am. It was wonderful to hear about stories of hope despite all the fears during the pandemic. Also, how you help the community themselves as well as children overcome these fears despite all the media attention that COVID got and only the negative aspects. It's wonderful to hear just how children can make such a big difference in the way we perceive things. I think partnership is also an extremely crucial element that you shared about. Looking at the relief, restoration, as well as reinventing and reimagining the new normal is extremely important over here. So thank you very much. Since we've heard a lot in the last 15, 16 minutes, let's take 2 minutes to just synthesize everything that we've heard and note down our learnings for ourselves. And then you can also post your questions on the chat window, post which we'll move to the second speaker. Hello, sir. Mahadeva, sir, ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
You are hearing?
Yes, sir. I can hear you. One ನಿಮಿಷ ಕೊಡಿ, ಎಲ್ಲರೂ ಬರೀತಾ ಇದ್ದಾರೆ. ನಾವು 5:20 ಗೆ ಎಕ್ಸಾಕ್ಟ್ ಶುರು ಮಾಡೋಣ.
Okay. I am already sending one PPT to you.
ಹೌದು ಸರ್, ಅದಿದೆ ನನ್ನ ಹತ್ರ. ಅದಿದೆ ನನ್ನ ಹತ್ರ ಸರ್. ನಾನು ಅದು ಶುರು
just now.
ಇವಾಗನಾ? ಓಕೆ, ಒಂದು ನಿಮಿಷ ಸರ್. ಚೆಕ್.
ಇವಾಗ ಒಂದು PPT ಕಳಿಸಿದ್ದೀನಿ. ಅದ್ರ ಬಗ್ಗೆ ಏನಾದ್ರು ಅವಶ್ಯಕತೆ ಇದ್ರೆ, ಬಟ್ ದಟ್ ಇಸ್ ನಾಟ್ COVID-19, ಅಬೌಟ್ ಮೈ ಕ್ಯಾಪ್.
Right, Vaikunth, let's proceed.
Sure. So sir, ಆ PPT ನಾನು ಇವಾಗ ಓಪನ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ನೀವು ಬೆಳಗ್ಗೆ ಮತ್ತೆ ಮೊನ್ನೆ ಕೊಟ್ಟಿರೋ ಪಿಕ್ಚರ್ಸ್ ಎಲ್ಲ ಇದೆ ನನ್ನ ಹತ್ರ. Okay sir. So
my own, yeah.
Yes sir. So up next we have Mahadevaya sir from Myrada. They've been working exclusively. He's been working exclusively in the HD Kotte area, and they've done tremendous work. And most of the populations they work with are primarily agriculture based, and he's been in charge of a lot of the awareness campaigns for farmers in the area as well. And they've got multiple programs running, so sir will take you through that. So thank you very much sir. Despite all the technical glitches, it's over to you. Thank you sir.
Okay. Can I start?
Yes sir.
Hello.
ಹೌದು ಸರ್, ಶುರು ಮಾಡಿ.
Okay. My name is Mahadevaya. I am working as a training coordinator at present. My organization name is Myrada Kaveri Pradeshika Samsthe. Basically, we are working with institutions, CBOs. CBOs means SSG, Watershed, WDA, and CMRCs, SHG Federation. LG means learning groups, FPO, and so many CBOs. Now I am going to give some of the what we have done in last in COVID-19 progress. I will tell now. We have so many 200 and something learning groups. That is learning farmers group. Learning group is better cotton initiative farmers. That is one of the projects. Then we are available children and SHG members, all those things. But in 2019, after April, against COVID-19, our SHG members are biased about gathering the meeting. That is one. Another one, our LG farmers also, they are not made. Because of Corona. Then all schools are closed, In that time, our organization taken so many programs and programming awareness. In the beginning, we are covering so many at the time of in tribal areas. Tribal areas is very, very, tribals are inside the forest. On that time, they don't have labor, then they don't have the agriculture season. That time, they have more trouble for food also. On that time, we are gathering from government, MLA, and some other person. You are called and given. On that time, you are supported to the so many, more than 1,000 kids from different RDs. And another one MLA, they agreed to give Kalavidas means they are some of the what they are telling in Kannada marriages they are using. In this season, they are very, very afraid in SD Kotte Taluk. On that time, we are given support to them. Afterwards, we are given about awareness. But basically, COVID fully is not affected in villages. By media, they are very, very afraid. What is COVID? What is COVID? in Mysore is COVID like that. But at present they are not having fear about COVID. But we have taken so many programs about COVID-19. You seen in the picture, we are calling in all our farmers morning 6 to 9, calling in the village about we are given training, not distributed only a mask. That's not, but we are calling to given and they are sitting about awareness and COVID. What is the distance? What purpose this distance maintain? You eat very good food, immunity, and how you are going to activate in this time. But how you are working in the field, like that, we are given training to the community people. At present, till now, we are completed till today 6,061 farmers, including children. Today, then about we are given masks also we are not purchasing from the shops. We are given employment opportunity to the our SSG women. We are given opportunity. We are already at present 12,000 masks are stitched by SSG women. This is also one of the important. Then every day morning we are going to the village. Our staff also they are engaging, but here our staff also very carefully. Why they are traveling the village. Their villagers they don't know about the distance also. Why they are gathering all knows people. They are not keeping distance. That's why we are given distance. Why? They are in our villages nearby. They are not allowed outside people inside the village. Some 2-3 months. Afterwards, at present, now they are allowed inside our village. Now they are keeping distance. They want to purchase some vegetables and all those things. They are ready to take what is the distance and washing hand like that. We are given. So farmer community is very important to our rural India. That's why we are given more careful to our farmers. Then when they are workers, they are working in the field. You see in that picture, working in the field. We are given in the field. We are keeping the distance. You are given in the field how you are maintaining in your house, your husband, your children, your food practices. All those we are given to them. Then till now you are not conducting any federation meetings, SHG's federation meeting because of COVID. Our SHG members gathering in every month more than 125 in each federation meeting. We have so many federations. That's why you have taken that one also. That you are using our staff. We are working in Mairada. Mairada is working in 3 states in Andhra, Karnataka, and Tamil Nadu. But in MyCap is one of the organization of Mairada, but it was fully engaged in 2008 onwards. We are more than 50 staff. We are covering in Nanjangud Taluk, SD Kote, and Piriyapatna. Mostly in that time, in COVID awareness, most of the villages are suffering for food something. In that time, we were talking with the EO and CEO of Jilla Panchayat, EO and PDO of the Grama Panchayat. In that time, how they are going to do their Mahatma Gandhi Narega work in the field. They are engaging and they are doing work there only with maintaining distance also. Distance. We are given training to them. Then we are calling the teacher and all those. In this time, more than 150 tanks are desilted in Corona times. Corona times, our farmers are getting very good jam from the government. Then you see the another one picture. We are calling the children and both the parents also. How their children are activate in that time. Some of the farmers and they went to the city. They are bringing from biscuit something. They are not washing hand and something. Their children they are very eager to get the biscuit, you know. And that time we are how you are active at that time, they are how. Then some of the agriculture inputs in that time. Most of the farmers they are going to nearby the Kote and some of the small cities. On that time we were talking with the agriculture officers and the Raita Samparka Kendra how to supply without disturb the farmers. They are thinking we are supplying uh, fertilizer to nearby the village to get easily. They are involving very nicely in farming work. In this year, that in the COVID season, in HD Kolette Taluk, it's farming is very most of the farmers are doing very good farming work. One is very affected, you know. Some of the village youths, they are working in the cities and Bangalore, Mysore, and some of the big cities. And that families, they don't have money in the COVID situation. That is affected to their family to do their daily work. Like that, we done so many things. Um, and then our CMRC means Community Managed Resource Centers. This is trusts and the cooperative society and act. All the cooperatives act, act and the trust. All trustees become the SHG members. In that time, they have done very good job in the villages. How they are maintaining. Some of the CMRCs, Community Managed Resource Centers, are distributed the uh, food kit to the very needy families. Then some of the families they don't have the ration card also. We are going to approach the PDS shop to get the food. These type of the works we are taken in that time. Totally, we are given training 6,061 people and they are getting masks also. Apart from that, we are given our staff training. We are given in the some of the banks and cooperatives and so many people. These type of training you are given these times. If you have any questions about Myrada, you can ask. What we are working so many things about. We are pioneer about SHG also. We are working a watershed, rainwater, roof water harvesting, eco sanitation programs, biogas programs, and organic farming. Now we have more than 7,000 organic farmers we have in our project. We have two FPOs, two, three FPOs. They are working like that. We are working through institution how to manage the COVID-19 situation. Okay.
All right, sir.
Venkat,
Thank you
you
very
have
much,
any?
sir. Yes, sir. Thank you very much. You spoke a lot about just having partnerships and bringing the government together as well as local politicians, as well as not just distributing thousands of kits, but the importance of also providing employment opportunities and not just distributing kits, and as well as providing training to the beneficiaries who receive these kits. And over 12,000 masks have been stitched by members of the SHG alone. So thank you very much for that, sir. There are a few questions for you, but I'll ask you that in the question and answer session. A few people have just sent that in. Yeah. All right. Since again, a lot has been shared, let's take 2 minutes and just synthesize this. It's 5:33 currently. We'll be back at 5:35. Let's just take time and synthesize, and then we'll start off with the next part. Jesu ma'am, we are taking 1 more minute to just synthesize all our learnings. We'll get back in exactly 30 seconds.
All right. Let's bring the conversation back to the group. Thank you everyone for patiently participating, for listening, to everyone who's sharing. I want to bring your attention back. This was the part where Agastya International Foundation was to speak, but since we don't have them today, we felt that it would be great to invite our speakers who are here to contribute to this. And very quickly, IndiVillage could share a little of what we are currently doing. And that's not a lot, which is why we're seeking advice and opportunity from the community to help us figure out. So impact on field operations and delivery is not how we've reinvented our programs or readapted, what was happening earlier, but very, very focused on tools, techniques, strategies, methods that are working for us. On how we're reaching out to our communities and how our day-to-day operations have shaped up, right? As IndiVillage, while we are headquartered in Bangalore, which means that the program team is based out of here, our direct impact, of course, happens in rural India, and we have our field team, Mujib, Krishna, and Deepa, who are on this call already. And it has been a struggle for us to continue our programs and reach out or expand or reach out to more beneficiaries, primarily because the first switch after the pandemic, when mobility was restricted, everyone moved to technology as a way to aid them in continuing their operations. And being in rural India, and the other organizations will agree or differ, I look forward to hearing, the digital divide became a very, very big challenge for us, right? And at the same time, it was also important for us to ensure that our field staff was safe, that mobility was restricted there, and we had to respect those boundaries, and we had to ensure that we were expecting the same out of them as we were practicing. So here are some things that have worked for IndiVillage. And how we've been both interacting with each other, interacting with our beneficiaries, and conducting our programs. And this might resonate with a lot of you, but please, after this, if Sneha and Naz and then Myra could share, what are some tools and techniques particularly that you've been using, right? So because majority of our beneficiaries are, well, right now are children, and majority of our beneficiaries do not have access to 4G phones and operate on 2G phones. One of our programs had to move completely on a teleconferencing basis, where our facilitators were connecting on weekly calls for check-ins. Students would connect with other people that they were networking with on phone calls. Where WhatsApp is available, we're looking at WhatsApp subscription-based lists, broadcast lists, and where we can do easy file sharing, some of which we have also done, where children who have WhatsApp through another family member or through the neighbor is able to continue to access education content or other COVID kind of content. WhatsApp has also been very, very useful for us to leverage that as a news sharing space. So we also realized that because news consumption on COVID is so rampant through WhatsApp, it was important for us to spread the right kind of news. So we created an awareness initiative that was just WhatsApp forwards of videos, links, creatives that made the right kind of information reach our communities. We have also been leveraging Zoom, Google Meet, WhatsApp calls, but more so with the IndiVillage staff, because we are privileged to have those kind of resources while our beneficiaries do not. But that is something that we're hoping to build in our beneficiaries. That is the kind of capacity and resources that we're hoping to build in our future programs. And lastly, we're also leveraging community clusters, because as we happen to work in a town where school children typically live close to each other. So addressing or sharing resources at in one particular neighborhood at one point where others can pick up. Or previously, when we did one of our drives in which our office or our livelihood center becomes the hub for where all activities happen. People come and pick up resources from there and then pass it on to neighbors, relatives, family members. That is also a network that we are leveraging. I have a question that if the other speakers could address in the following bit on how to leverage local volunteers, how to mitigate their fear while ensuring their safety. That would be something that Indie Village could learn from. So over to you, Kalyani, maybe, or someone from your team could talk about how you continued your sports intervention, because sports is also physical, sports also requires the children to come out. And then maybe Jesu Akka can share, and Mahadev sir could also share about how, what tools and techniques you're using. Right.
Yeah, so thanks, Shreya, for the question. And clearly, you know, once the lockdown started, we stopped the physical sport part of it completely. Yeah, because I think one of the biggest learnings from this is keeping the physical distance and keeping the risk level in mind. So what we realized was that, you know, when you bring children together, it is but natural that they will play and enjoy, and then it's very difficult to maintain physical distance. So keeping that in mind, what we realized was, once, of course, that the community interventions are programs that ran in the communities as well as school, you know, because we work with about 15,000 children in the school settings, whether in the villages or in the urban areas, but the schools were shut. So I think the first part of it was that how do you help your own volunteers and your staff understand the risk levels? And I think demystifying the information that is available, you know, because the challenge has been that, you know, the school of WhatsApp has a problem of over sending information, and not all of it is right. So I think just helping people understand what the COVID-19 pandemic was about and how it really is relevant from their context was one of our first pieces, you know, because even though there were a lot of videos, it was not about sharing them, but really simplifying content and helping staff understand. Because when people understand the information, when they are able to communicate it in simple language which the community members can understand, then that makes it all the more easier. I think fear, like even Mahadev sir said earlier, fear, and even Jesu Akka pointed out, fear is one of the biggest challenges. So I think helping them understand the information in simple terms was our first focus. And two, also that people needed to realize that they have to keep themselves safe first. I think modeling as a tool and technique is very, very critical. When you see that the coach, the facilitator, the staff is following all the regulations, that really becomes an modeling and an inspiration for the community members. So even for our community outreach workers, our field staff to know that you can't randomly just go into the community and meet people, you know, because social distancing in our country is not possible. Most people think, you know, oh, what is there? You know, we are safe. She wouldn't have gone somewhere. So I think just helping people understand the whys behind the hygiene practices was very critical. And once people understood, we realized that people available for relief work will come up if they are sure of what they're doing. The second piece was really the health and fitness of the staff and themselves and the volunteers themselves. You know, the fitter people are, the greater the lung capacity and the immunity, the lesser the chance that they would get sick. So throughout the lockdown, with all our partners, with all their staff, we've been doing physical fitness sessions every day. So every day from 4 o'clock to 5 o'clock, we've had a session for staff, different physical fitness programs. Sometimes they've done Zumba, sometimes they've done yoga. They have done no equipment, right in their houses, without any fancy sport equipment or exercise equipment, how can you stay fit? So I think these tools to really help have helped people realize that if they can keep themselves fit, they can also take a step and help the community stay fit. So I think that's help has helped us retain people, and also that if you've really not been well, if you have shown any symptoms, how do they really take the isolation seriously, right? So I think these pieces have, through our videos and through the content, we've ensured that people have understood this messaging. I hope that answers.
Yes,
yeah,
thank
and
you.
I just had one more thing which I saw. One of the questions was really on what role can women play? And I think, because we run a women's leadership program, I think this pandemic also showed that this was the first time when most of the male members in the house were in the house, right? We've realized that we've had access to participants, but typically their fathers never come to any session. You never get to meet the brothers. So I think really building the young women and the women in the family as leaders, this has proved a really wonderful opportunity during this pandemic, because we've been able to accelerate and leapfrog the leadership process. So the community sport coaches that Jeswaka spoke about, they really helped the staff previously. But now in the communities, especially when there is a digital divide and there is no access with, Zoom and stuff like that, these community sport coaches have been able to facilitate sessions with smaller groups. So, six people, keeping the 2 feet distance, keeping the mask. They've been able to do smaller sessions right where they live, and because this also has given a chance for them to use the leadership potential within them. They have received training, but in the past they had never led sessions independently. And I think the community champions, so the women in the communities, the mothers, their role has become more significant because there is also a lot of domestic violence, because everybody's at home. It's like a pressure cooker. People have lost jobs. So I think really helping women address the issues, look at safety and child protection has been critical in this period.
Right. Thank you so much. Thank you for sharing. Jeswaka, if you could speak from the angle of, so you talked about getting more children out and children doing activities, right? And I'm sure there are volunteers or facilitators required to conduct such an activity. Jeswaka, can you hear me?
Yeah, I can hear you.
Great, great. Thank you. So what about the apprehension of the volunteers itself, right? Because on one part, yes, of course, as an organization, it becomes very important for us to make sure that they understand what safety norms are important and we prioritize. But after that, we have to continue to facilitate things. So how did Sneha approach that?
I think that I have to add to both. We have been working with the community for a long time. Children are not the only groups with which we work. There are women in the villages. And so the rapport what we have built with the villages, and the community sports coaches are from that villages itself. That's a main point. They are not outsiders. So they have already built a rapport within the village. So they believe not only the coaches, but also as an organization, that when we approach through community sports coaches, they believe that what we say is truth. So the trust that what they have in us for our long-standing work. So that helped a lot to convince the community sports coaches. But we also have taken precautionary measures, like in Tarangambadi, the community sports coach was working and bringing children. But there is an outbreak of COVID now. Corona patients are identified. So the entire village is blocked. Then we also stop work because definitely we cannot reach them. And winning over the community is the first thing. And their trust is the first thing. Then through that, definitely the community sports coaches can be also, their confidence level also gets built up. That's the next thing. And through trainings, as Kalyani was saying, every day these community sports coaches, they come through Zoom. but it is really, we are pushed to a world of digital world, and they have to, most of them don't have computers at home. They only use their mobile phones and have downloaded Zoom, and through that they are participating in the all exercises, and it has helped them a lot. And we also need to have meetings through Zooms through which they come. Otherwise, if not possible, as rightly pointed out by the earlier speaker, we go through conference call and try to keep them, build the confidence level. That's the first thing. And the major challenge is transport. As somebody has asked in the chat box, we are not, transport was there. And initially, a few transport, public transport. Now that is also stopped. So no autos, only the only mode of mobility is two-wheelers, unless the women who are here as trainer, coaches, or coordinators have two-wheelers, they are not able to reach the village through materials, health mix, everything. We reach them through these women by getting government permission. Also, we reach them the materials for their own, or use the locally available material, whatever it is unused. So that is how we have built the confidence in them through NAS as well as our regular inputs and interactions. Yeah.
Right. Thank you. Thank you so much for sharing that. Mahadev sir, 2 sentences from your side also. We could hear about how these congregations were happening, and was health and safety, of course, it was there on your minds as well. But what are some other techniques that helped you to reach out to more and more people, given that Mairada works in grassroots?
Madam, in our area, in beginning, all are aware about Mairada, but we are first we are given training how people are activity in the village. That's very important. In our village, Madam already told you know, in our village, all the roads are blacked at that time. But we are, all the people know Mairada papers, what they are doing. They are aware about Mairada, they are helping to our health and other economic activities. That's why they are accepted. But in that time also, we are maintaining distance to the community. It's very important. All the community people know. Each one, every people will know. But we don't touch them. We are standing like that. Okay, we cannot give second like that. Namaste, we are told. Like that, they are taken. Mairada people, they are having all the community very impressed. Anyhow, they are given very good training. That's why one day we are given early morning 7:30. Within 9:30 we are doing more than 5 to 6 batches. They are waiting. First batch is children, then men, women, like that. What they want, but economical situation, how they are activate in your village. Bank, we are approach bank also. In the situation, give more loan to the SHGs. They are getting under NRLM is 4% interest loans. That is also, we are activated like that only. We are giving all the, but in a way, I am now forgetting one is no. We are not, you are returning wall board, what signboard about COVID-19. We are writing in the village, not in the city. City somebody will doing. We are going to do in each village one wall signing board. How they are, which picture. All the people aware about this COVID-19. Now, most of the people they are having their own mobility. Sometimes their auto. They known people they are going. Otherwise, they are not traveled.
Right, right. Thank you. Thank you so much. With that, I'd like to open the forum for the audience, so we can go about this 2 ways. Swarna has been making note of the questions that have come up, but again, because we're a small group, we have the opportunity, we have the advantage to directly address questions, and I think that that is a great opportunity for us. So what I'm going to ask everyone to do is, if you have a question, if you could just raise your hand, we can easily call out to you, and then you can either share or address a question at a speaker, or share what your own organization is doing. Okay. If that is not something that the group wants to do, we also have questions that some of us have left on the chat box, and we could maybe share those questions. Swarna, do you want to read out some of the questions and address it as speakers?
Yeah, sure.
Yes.
So from the chat box, I'm just reading it in the order that it came. So first one was how important is it to engage women during this time? What role can they play? I think we've answered that question. Naz and Sneha contributed to that. And the second one is how could you transport the impact with the children to the families? Was there communication material distributed to the kids for the families? This was by Katya. Would anyone like to take the question forward?
No, in the discussion when I was sharing, it is not that we gave the materials many times. The announcement by the through videos were use the unused materials at home. And I found a beautiful work of a child with the clay. She has just bound it together, and with sticks she has just put, and it is Corona. So it was very beautiful, that image was, with some seeds also on it, red dyed. So, so unused materials, using that and doing creative work. So we need not reach any material to them. But now we are reaching. And using the newspapers, waste papers for origami, that also doesn't need any material. So, but when we need material, we have reached them through the community sports coaches, trying to reach them through two-wheelers and get permission from district administration and reach them. And taking the children, involving the families, because the entire work was done when in April and May with the family members. It was not in group. So the mother got involved. The many videos we can see. The brothers got involved, and watering the plants and all these activities, there are different activities. It was encouraged. So the family itself and the women playing with them, playing in the sense, keeping distances, they were dancing, and it was videographed and it was sent. So it helped us to reach through that means. Thank you.
Thank you. Thank you, Jessamine, for sharing. So this question was specific to the communication material also. So when we are talking about sharing the information and spreading awareness about COVID situation itself, I think Katya has mentioned about how that information has been getting relayed to the community itself. And if I'm also combining another question by Shreya. So how are we bringing this information and awareness through the volunteers to the community? So would someone like to take that question up?
I think someone has answered already about this, sharing videos through WhatsApp. So that was one thing. Yeah.
You know, like I said, we had also developed our own videos. So, you know, these videos were in vernacular medium. So it was in the language that the participants and the staff and the volunteers could understand. So these were sent through WhatsApp to the volunteers and the staff. And then they in turn had the freedom either to share on WhatsApp, or when there was no digital space, you know, there's a gap, they're able to do those sessions with the community members. Yeah.
All right. Thank you.
Right. Swarna, I would like to address a question at NAS Foundation particularly. So the fear, the threat of the pandemic is going to continue for some time, right? And the operations of our programs have got severely affected. Do you feel, of course, training right now, making the coaches aware is great, but do you feel that the same safety measures will be taken seriously despite reopenings and regaining a normal life? And how do you see this impacting long term? So what is really your plan for the future? How are you completely redesigning the way you're approaching this? Or are you going to, after a couple of months, take a call to reinforce how things were running like earlier?
No, thanks for the question, Shreya. But clearly, COVID education, distancing, and the priority on health is going to be the focus for a long time to come. I don't think it's just about the pandemic now. It is clearly about changes that you're going to make at least for the next year or so. So I think making COVID education a part of our curriculum is one of the most important things that we've done. That it is not about just now, it is about a new way of living, because even in the communities and in the schools, they're going to bring back children in a staggered fashion. But I think for them to really imbibe that they are at risk and they have to make changes in their hygiene, in their lifestyle, in the way people really meet and greet is not easy. So I think it is about redesigning not the work we do, but also keeping the risk factors and keeping the what makes the communities vulnerable. Festivals, marriages. Now, this is something which is in our fabric of our culture. So I think the fact that people will be doing, and rather than preventing them from doing, how do they really make their own health a priority? So I think all our materials, the way we train our staff, has to keep this piece as a part of the design, and then only, and the more we have people modeling it and explaining why, then it will become a part of their daily lives.
Right, right. Thank you. Can I also invite Deepthi of Go Sports Foundation to please talk in why I'm saying, because there's of course a direct connect, and sports very evidently becomes an area of challenge, right? So Deepthi, could you share your thoughts on how Go Sports is approaching this?
Yeah, hi everyone. I think I learned a lot today with the different challenges that all organizations have and how we've tried to really navigate through the pandemic. For us also, it's been quite challenging because we really work towards large format tournaments and events, and the Olympics, has itself got pushed 1 year ahead. So a large part of what we were doing suddenly, for an athlete, it's very important that they know what they're doing next week, next month, 1 month later, and they're always traveling. So for us, it was really relooking at the entire aspect. But I think we spoke a lot about the mental health aspects, physical well-being, and just really maintenance. And at this point, we were really just focusing on these three aspects, a lot of online sessions. Luckily for us, the athletes that we work with all have access to mobiles, all have access to internet, mostly. Very few of them come from very humble backgrounds, but they still have a phone and they have a telephone connection, so we could still connect with them. We have a project in the Northeast, so that was it's a big challenge for us. So we're doing conference calls and really having communication with them through that. But we also launched this program called Play for India, because again, we all spoke about different communities, but over here we realized that coaches, people who take care of our stadiums, and really the bottom of the pyramid in sport are deeply impacted. So what happens to them, because they all depend on day-to-day daily wage. So we created this program where athletes could champion causes and they could really raise funds for the people who help them on a daily basis, and that really kicked off really well. And we were able to support almost 500 different beneficiaries across the country, just giving them basic money. And we got some very, very heartening messages where some people have written to us saying thank you so much, and it says your balance in the account is, we credited about 8,000 or 10,000 rupees for them to float through this time, and the SMSs kept telling us that you now have 10,050 rupees. So I don't even know where the next meal would have come for that family, because apart from that child, that athlete or that coach, even their parents are probably daily wage workers and they've all lost jobs, and livelihood is deeply impacted. And in the scheme of things, sport is really not being looked at as an important aspect. But what we're really trying to make health, to stay healthy. And COVID is talking about people who have high immunity and who are physically fit are going to be out of the COVID situation. So we're really trying to go through that aspect. But as an organization, we actually created a very new program, which we would have never done in the past. So COVID accelerated us to think about a very different segment. And I think, so changing and really moving with the times is probably what COVID has taught us. And I think it's very similar to a lot of us who we would have assumed that, oh, we only have to do physical meetings, or we only have to meet them physically, only then they'll value us more, only then there'll be a connect. But today we've had to do a lot of things which we otherwise would have not thought of. So I think we have to try and look at the pros and the positives of what COVID has taught us. But yeah, it is going to be difficult times, and till we have no certainty on a vaccination, I think we will be in a gray area. But I think it's a challenging time, but also a time to introspect and create new channels and verticals if required, because you'll never get this time again, I feel, to really think back and think through all these aspects. And thank you so much. I really learned a lot from Kalyani and from Jisu ma'am. Just, the passion with which they were speaking was really very inspiring. Thank you so much.
Thank you, Deepti, for bringing out that perspective from a previous conversation with Dilip of Sukhi Bhava that works towards menstrual hygiene. This actually draws a connection where certain areas or certain domains are sort of taking a back seat in the current situation, right? Like sports may not seem like a priority, but sports could play a big role. Similarly, menstrual hygiene is not a conversation, is not a priority right now, but that's what Sukhi Bhava is also trying to push. So thank you for building that perspective. Deepti Natarajan, if you could tell us, because Head High is so widespread in the country with over 20 states where you're working, how does the relevance of a community center increase right now? And what is the potential of a community center in community outreach and engagement at this point?
Right. Thanks, Shreya. And before that, before I answer the question, like the other Deepti said, definitely a very, very engaging dialogue and lots to learn from all the people who spoke so far. Right, talking about the community response center, that's a big initiative that Head High particularly is undertaking. And we are setting up a lot of these centers. Originally, we were into training youth who dropped out of schools. So we had about 65 training centers across the country. Now, after COVID and thanks to COVID, these centers have taken a new avatar called the Community Response Center. And our belief is that each community has its own need and its own way in which it's responding to COVID, in which it's being affected by COVID. So sitting in Bangalore, I can't say do this in Gujarat for the COVID community. That won't work, right? One solution will not fit all. Rajasthan will be hit differently. Maharashtra is hit differently. There are other local problems as well. And Head High, as it is, its heart lies in the rural India. So we've set up a lot of these centers called, our training centers itself have taken a new avatar called the Community Response Centers, where they look at the need of the community around them and look at what the community needs. See, the gap is in what is needed and where it is, that's where the gap comes. So the main work of the response centers is of course, information dissemination. A lot of people, new problems are arising mainly because people don't have the right information, whether it's about COVID, whether it's about livelihood opportunities in this situation, whether it's about social security schemes that government has floated around. People have no idea. And the more rural you go, we have people who are some of our beneficiaries who say, "Acha, Bangalore mein bhi COVID hai kya? Delhi mein bhi COVID hai kya?" They're surprised that COVID exists in all the other parts of the country as well, right? So that's how the situation is. So the response centers disseminate information on livelihood opportunities, on a lot of social security schemes that the government has now released, how to get through to these schemes. Basically, most of these social security schemes fail because of the last mile connectivity. People don't know how to get how to get the benefit of these schemes, right? Whether it's the Jan Dhan account or the Ayushman Bharat, people don't know how to get it. I think before COVID, even I would not know, right? So the community response center's main job is to do that last mile connectivity between the people who need these schemes, need these facilities, and the actual social security schemes. And dissemination of information, awareness about COVID, about all the other issues that have come up because of COVID, including waste management, just disposal of masks, lots of things, right? And it does it at a very community specific level. Another important thing that the CRCs, the Community Response Center, does is, so a lot of people have moved back from cities back to the villages. And we ourselves did a survey with our beneficiaries, and almost 60% said, no, I'm not going back to the cities. I don't want to be stuck up in quarantine zones and relief camps over there. I'd rather be in my own village, right? Even if I'm not earning, I'm happy here with my family and with my parents. 40% have said, maybe after Diwali, I'll go back, because I still need a job, right? But I'm not sure. So in this case, but then they still want a livelihood, because like somebody else mentioned, the entire family is affected by COVID. It's not just one person. Whether you're affected by the virus or not, you're affected by its financial, if you're financially affected by the COVID, right? So setting up self-employment opportunities for rural youth who have come back to their villages, opportunities which can thrive in these villages, and they can actually make livelihoods. And we also work in them getting the market linkage, so that the risk of that business itself comes down, right? So we've got women who stitch masks, we've got women who stitch cloth bags, we've got women who are now making leaf plates, and we are also connecting them to the market linkages, so that there is a definite buyback and there is a definite livelihood that's created. It's not just that, set up a business and you find your buyer. It's not that. And that can happen only if you work at a community level. Sitting in Bangalore, I can't do that to someone in Gujarat. I have to have a community response center right there to do this for them, right? So that's the, I think, goal for this year for Head Held High, to set up as many CRCs as possible, so that we enable communities to come out of poverty, which itself is Head Held High's goal, and specifically now to come out of the impact of COVID, the financial impact, especially of COVID. That's the whole concept of the CRCs.
Thanks, Deepthi. Yes, thanks so much. And that is why spaces like this, where we enable conversation, become so important, right? Because now organizations who are in those geographies of people can reach out to you because they know that Head Held High is doing something like this. Thank you for sharing. And Dia, hopefully this responds to your question also that you had asked initially. Great, thank you everybody for engaging. I'm going to hand it over to Vaikunth to quickly summarize so that we can honor our commitment of the time of 6:15. And before that, also quickly share some next steps with everyone. Vaikunth, over to you.
Thank you very much, Shreya. Thank you very much, Deepthi, and all the speakers as well. I think Jesu Akka, Kalyani ma'am, and Mahadevaya sir. What you really spoke about resonated a lot with me, having heard a lot about the various ways other nonprofits and other organizations are dealing with the pandemic. I think what's the core of every organization's involvement with the community is just trust building. It's very crucial to have that kind of relationship building over time. And then at a crucial point like the pandemic, you're able to leverage this trust to a greater extent. And many times you have a lot more access to the community than a lot of government representatives itself, given your proximity to the community. So thank you very much for just sharing the importance of trust and building authentic relationships with the community. Conducting training that is essential to the staff in terms of capacity building. I think that really trickles down for the rest of the community as well. By word of mouth is how all communities in India transact news, and I think it's extremely good to bust a lot of the myths as well as have training. The tough part is that we've been very reactive to it. It's a pandemic, but I think just ensuring that this kind of news is filtered in and appropriately given is really good. I think the third and final big takeaway that I have personally is just the different situations that have emerged as a result of COVID. Whether it's pivoting programs, whether it's just a different form of training, and definitely not only acknowledging the digital divide, but trying to bridge the digital divide as well. I think all of these play really crucial roles. So thank you very much. We actually are open to speaker suggestions for the next Samvāda as well as topic suggestions. So just quickly go through the slide that we have. It can be absolutely anything, all the way from microfinance or the future of SSGs to fundraising, the new normal, which I know is extremely crucial, to all nonprofits, especially at the time of COVID, or it can be even around MSMEs, social stock exchange, and various others. So if you can just go through this, feel free to add to this list as well. You can write in to samvāda@indivillage.com. You can reach out to Shreya, me, or Swarna as well. And yeah, thank you very much for engaging in the space. It was wonderful having all of you here.
Right. Thank you, Vaikunth, and thank you everyone else. We are going to continue doing this, and like I said in the beginning, that we're experimenting still with the format, with the way, with the number of people, so we can keep it intimate and we can prioritize depth over scale. Samvāda commits to be a monthly dialogue event where people across the industry can come. The topic will remain problems and solutions in rural India, because that is Indivillage's commitment and interest as a rural social organization. But please feel free to engage. Like Vaikunth said, please feel free to nominate topics to us also. We want to learn from the community, and we are going to document the learnings from today's meeting in an article that we will share with you. We will also share a short feedback form with you tomorrow. Please do engage. The next Samvāda is on 23rd September. By now, you're already on our email database, so you will receive details of the next event. Please do follow us on our social media handles in case that is somewhere that is easy for you to get updates on, and do stay in touch. With that, I wish everyone a very good evening. Thank you for joining, and look forward to seeing you again.
Thank you.
Thank you.
Thank you.
Thank you, speakers, for your valuable time.
Thank you. Thanks, Shreya. Thank you, Vaikunth. Thanks,
We were
everyone.
able to do this.
Yeah,
Thank
bye
you.
bye.
Goodbye. Take care.
Thank you, Mahadev sir, for joining.
Thank you, Mahadev
Thank
sir.
you.
Tumba connection problem yella ittu adru ನೀವು call ಅಲ್ಲಿ ಇದ್ರಿ. Thank you very much for that.
Thank you, Krishna.
ಎರಡು ಮೂರು question ಇದೆ. I'll send that to you offline, sir. Sir, ನೀವು ಇನ್ನೂ ಮ್ಯೂಟ್ ಅಲ್ಲಿ ಇದ್ದೀರಾ?
ಸರ್
ಇವಾಗ ಕೇಳಿಸ್ತದೆ.
ನೆಕ್ಸ್ಟ್ ನಾನು PPT ಎಲ್ಲ ರೆಡಿ ಮಾಡಿ ಕಳಿಸ್ಕೊಡ್ತೀನಿ.
ಖಂಡಿತ ಸರ್. ಶೋರ್ ಸರ್, ಖಂಡಿತ. ನಾವು ಏನ್ ಟಾಪಿಕ್ ಇದೆ ಅಂತ ನಾನು ನಿಮಗೆ ಹೇಳ್ಬಿಡ್ತೀನಿ ಒಂದು ವಾರ ಅಲ್ಲಿ.
ಓಕೆ ಓಕೆ.
ಥ್ಯಾಂಕ್ ಯು.
PPT ಕಳಿಸ್ತೀನಿ ಅಬೌಟ್ ಮೈ.
ಓಕೆ ಸರ್, ಆಯ್ತು.
ಓಕೆ ಸರ್.
Sorry, I had to remove them. They were not leaving. I said, thank you, Krishna. Bye. Congratulations, everybody. That happened. We honor the time.
Getting recorded. Please stop recording.